Good morning, I'm Clinton Griffiths. Bare shelves, absent employees, and virtual schooling, all signs of the latest surge from the Omicron variant of COVID. While health officials tell me the peak may be passing in some of the nation's biggest cities in rural America, the wave is just beginning.
So looking at data this morning from the CDC, we're seeing a lot of rural towns having a 6% to a 15% increase in COVID over the last 48 hours.
The highly transmissible and in many cases more mild Omicron variant has been pushing COVID-19 positive rates higher since late fall. Now, the wave is finding its way into rural America.
There generally is a delay when you have an outbreak of a new variant. There's a delay, and rather than have the sharp peak and then come down, you sort of gradually go up and then come back down.
New models from the COVID-19 Scenario Modeling Hub, created by university and health experts, now factor in the Omicron variant and show that the peak should be sometime between February and March. For many rural areas, the danger lies in staffing.
The real impact is on these small rural hospitals and their workforce. Workforce has always been a problem for rural facilities, but now after we've seen the pandemic really flatten the rural workforce, and we're seeing a lot of rural healthcare professionals become infected with COVID, they're struggling, honestly, to have the staffing that they need at this moment.
Getting help often means hiring traveling nurses at twice the cost.
And they're not always available. In many cases, the urban facilities are utilizing this service as well, too.
A lack of staff means patients have to be transferred, but options are limited. EMS services in rural areas are also short-staffed.
Just these three things are combining to make a really unsafe situation in our rural hospitals.
While continuing to strongly advocate for vaccines and boosters to prevent hospitalization or severe illness, Dr. Fauci recognizes all immunity will ultimately work together against the coronavirus.
I think when you get a situation of getting more and more people vaccinated or boosted, or unfortunately, people getting sick or getting infected, recovering and having a degree of protection, if you combine those two, there'll be enough protection in the country.
And Fauci says together, it should help lead to the pandemic's end.
Well, it will end. I can guarantee you, and your view is that it will end, hopefully sooner rather than later, that we will reach a point where the virus will be low enough in the community as to not have any impact on what we do, that we can get ourselves back to some form of normality. It doesn't interrupt the economy, doesn't interrupt our way of life. And that's what we're hoping we're going to be seeing within a reasonable period of time.
You can listen to more of my interview with Alan Morgan of the National Rural Health Association and Dr. Anthony Fauci by heading over to agweb.com. We've posted my entire conversations with both of them there. So what do we know right now about the Omicron variant? The Centers for Disease Control reports it now accounts for nearly all U.S. COVID-19 infections, saying that it has caused 99.5% of new cases in the last week. That's slightly higher than the previous week. The Delta variant makes up the remaining 0.5%. To give you an idea of how quickly this new variant has spread, at the beginning of December, it accounted for less than 1% of cases, but jumped to 89% by the end of December. Around the world, 18 million Omicron cases were reported last week.